Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2018. Number 025. Due to trauma, the patient has lost 25% of circulating blood volume. Name the emergency compensatory mechanism against blood loss. A. Increase of reticulocyte number. B. Erythropoiesis activation. C. Restoration of blood protein composition. D. Interstitial fluid inflow to the vessels. E. Restoration of erythrocyte number. Hypovolemic shock is a life-threatening condition that results when the blood or fluid supply is lost more than 20%. This severe fluid loss makes it impossible for the heart to pump a sufficient amount of blood to the body. It can lead to organ failure. During hemorrhagic shock resuscitation, fluid shifts occur at the cell interstitium interface and at the vascular, primarily capillary interstitium interface. The shift of fluid at the cell interstitium interface is an adaptive cell volume regulatory mechanism, and capillary interstitium fluid shifts are precipitated. The answer is D. Interstitial fluid inflow to the vessels.